6 years ago, a young woman gave birth to her first daughter shortly after finishing her master's degree in physiotherapy. Unbeknownst to her at the time, Kaite Schulz had given birth to a child with a fatal genetic disorder. After she had given birth to her beautiful daughter Sophia, Kaite discovered her newborn was going to go through life with cystic fibrosis. Despite the news of her daughter's diagnosis, Kaite managed to hold her head high, with the hopes that a cure would be found for her beloved child. Since then, Kaite has dazzled thousands of people with her perseverance, dedication, and strong belief in creating a world without cystic fibrosis. I'm Kobina Baiden, and today we sit down with the remarkable Kaite Schulz, president of the Cystic Fibrosis Canada Hamilton chapter, established physiotherapist at Hamilton General Hospital, a teaching assistant for the physiotherapy program here at McMaster University, and devoted wife and mother. Hi Kaite, I'm Kobina. I'm from the Shanorama team here at McMaster. It's nice to meet you.
It's nice to meet you. Thank you for having me.
So what exactly is cystic fibrosis?
Cystic fibrosis, it's the most common fatal genetic disease that affects young Canadians. It affects mainly the lungs and the digestion, but it can actually affect any organ in the body.
Okay, and how do you get cystic fibrosis?
It's inherited, so both parents have to be carriers for cystic fibrosis, and then with two carriers, there's a 25% chance that each child would have cystic fibrosis.
Interesting. So can you tell us what a day would be like for someone going through cystic fibrosis?
Yeah, so for Sophia, who's 6 years old, she wakes up about an hour earlier than her brother just so that she can do an hour of chest therapy. And then with every single meal and snack that she has during the day, she needs to take pills. So she takes about 20 to 30 pills to digest her food and also vitamins so that her body doesn't store those vitamins. So she needs to take extra vitamins and extra salt during the day so that she can hopefully be as healthy as her brother and as other kids. And at the end of the day, when she gets home from school, we spend another hour doing chest therapy. And then that's when she's well. So if she has a cold or anything like that, then we have to double her therapy. So it can be almost 4 hours a day of her doing chest therapy on top of all the other medications.
Wow, that sounds like a lot.
Yeah.
So what would you say is the most difficult part about having a child with CF?
The hardest thing is not knowing what her future is going to hold. So every day is different for her. Sometimes she gets a cold and she bounces back really quickly. Other times she doesn't bounce back as quickly. And it's that fear of what's happening inside her and what's happening to her lungs that is maybe irreversible. That's the hardest thing. I don't want to outlive my daughter. I want her to live longer than I do. And just not knowing that that is necessarily a possibility, I think is the hardest thing. It's painful, right? Like you kind of went through a bit of a grieving process when she was born because I was worried about her future.
As would any other mother would be,
Yeah.
right? So how common is like CF? Like, is it just both you and your husband were carriers and your daughter received it, or is it like really common?
So 1 in 25 Canadians are actually carriers for cystic fibrosis. And as I said before, two carriers have to come together and 25% chance of having a child with cystic fibrosis from that. So in Canada, for example, there's over 4,000 people living with CF.
So what would you say are the common symptoms of a person with CF?
So in the lungs, there are a lot of bacteria that get stuck in the lungs because there's a thicker mucus. And so they have trouble getting rid of colds. Bacteria stays there for a long time and they just can't really get better as quickly or as well. So that can lead to permanent lung damage. A lot of people end up needing a lung transplant with cystic fibrosis because of that. And also in the digestion, Sophia can't digest any of her fats or proteins or carbohydrates, and so she needs to take enzymes with every single meal just so that she can get the nutrition out of that. She also can't store any vitamins, so she needs to take vitamins every day so that she can be healthy that way.
So earlier you mentioned some of the treatments that Sophia goes through in terms of chest therapy and things like that. What would you say is the cost relatively of all these treatments for your daughter?
So luckily the government does pay for a lot of her treatments. She is on one medication called Pulmozyme, which costs about $1,500 a month. We're lucky in that my husband's private insurance covers that, but not everybody's does. And so not everybody ends up getting the same treatments, or if they do, they have to pay out of pocket, and that can really add up. She also has a lot of equipment that she needs for her chest therapy, and that costs hundreds of dollars a year on top of everything else.
So how is it that you got involved with Shinerama, and what are your plans currently on the Shine team?
So I first got organized with Cystic Fibrosis Canada when Sophia was only 4 months old. I contacted the local chapter and I started volunteering with them. And every year at Shine Day, I usually do a speech and tell people about my story and try to get people to understand how important it is to raise money for cystic fibrosis research and clinical care so that people like my daughter can live a long life.
So, as a parent, how do you try to provide your child with sort of a normal life?
So I try not to make her feel any different. So when she does treatments and takes pills that are different than other kids, I try to just tell her that everyone's different and that she's just a little bit different and her body works a little bit differently. And that way I don't think she feels singled out at school when she has to take her pills or if she has to come home early to do extra treatments. She's okay with that. When we go camping, I try to make everything as doable as possible for her. So we go camping every year. It's all what happens behind the scenes that causes my husband and I a lot of stress. So we need to make sure that all of our equipment can be charged by solar panels. We need to know how to keep her medication cool, whether it's sinking it to the bottom of a lake or bringing ice packs, depending on how long we're going for. But we try to allow her to have as many experiences as the rest of her friends as possible. It just requires a lot more work for my husband and I.
Wow, that's incredible. Well, it's been amazing getting to know you, Katie, and thank you so much for coming in and letting us know your remarkable story.
Yeah, thank you so much for having me.